Aging brings changes to every part of the body, and the penis is no exception. For men over 50, maintaining good penile health is about more than just sexual performance. It's essential for hygiene, confidence, and overall well-being. So, let's dive into 5 daily habits that can make a real difference. Prioritize proper hygiene. Every day, let's start with the basics. As men age, the skin becomes more sensitive and prone to irritation, so daily cleaning becomes even more important. Wash your penis gently with warm water. Avoid harsh soaps or body washes with fragrances, as they can disrupt the natural pH balance and cause irritation or dryness. If you're uncircumcised, it's crucial to pull back the foreskin and clean underneath. Smegma, a natural substance that can build up under the foreskin, may lead to odor, infection, or inflammation if not removed regularly. After washing, pat dry with a soft towel. Don't rub the skin vigorously. Moisture trapped in the genital area can promote fungal infections, especially if you sweat a lot or wear tight underwear. Speaking of which, 2. Choose the right underwear and keep the area dry. Comfort and breathability are key. As you age, you may sweat more or experience mild incontinence. Tight, non-breathable underwear can create a warm, damp environment that encourages bacterial and fungal growth. A recipe for rashes, itching, or jock itch, opt for cotton or moisture-wicking underwear. These materials help air circulate and wick away sweat from the skin. Also, consider changing underwear at least once a day, more often if you exercise or live in a hot climate. Keeping your groin area clean and dry is one of the most effective ways to avoid irritation and odor. Perform regular self-exams. Yes, this is important and often overlooked. Just like you might examine your skin for moles or check your blood pressure, you should be aware of changes in your genital area. Once a month, do a brief inspection. Look for anything unusual: lumps, sores, discoloration, swelling, or changes in skin texture. While most issues are harmless, some signs, like persistent sores or changes in shape, could indicate a more serious condition, such as penile cancer or an infection. Also, monitor changes in sensation or function. Erectile dysfunction can be an early sign of cardiovascular disease, diabetes, or nerve problems. Don't brush it off. Address it early with your healthcare provider. Maintain healthy blood flow and sexual function. Sexual health is an important part of overall well-being, even in your 50s, 60s, and beyond. One of the best things I can do for your penis is support healthy blood flow. How? Start with your heart. Eat a diet rich in whole foods, plenty of vegetables, fruits, healthy fats, and lean proteins. Avoid heavy alcohol use, quit smoking, and get regular exercise. Even 30 minutes of walking a day can improve circulation. Don't forget sleep and stress management. Poor sleep and chronic stress can tank testosterone levels and lead to sexual performance issues. If you snore or suspect sleep apnea, get it checked out. Sleep apnea is common in men over 50 and often linked with erectile dysfunction. If you're noticing changes in libido, erection quality, or performance, don't suffer in silence. There are medical options, therapies, and lifestyle changes that can help. but it all starts with speaking to your doctor. Stay on top of medical screenings and urologic health last, but definitely not least. Regular checkups are essential. After 50, it's time to start seeing a urologist, especially if you experience urinary symptoms, like frequent urination, weak stream, or nighttime urgency. These could indicate prostate issues, which are very common with age. Benign prostatic, hyperplasia, BPH, prostate cancer, and prostatitis can all impact not just urinary function, but sexual health too. Your urologist can also help screen for sexually transmitted infections, perform a thorough genital exam, and offer guidance specific to your needs. Even if you're not sexually active, regular STI screenings are still a smart move. Viruses like HPV and herpes can lie dormant and still cause issues later in life. Don't wait until there's a problem to make your health a priority. Prevention and early detection are far more effective than waiting for symptoms to show up. In summary, to recap, here are the top 5 penis care tips for men over 50. Practice gentle, thorough hygiene daily. Wear breathable underwear and keep the area dry. Do monthly self-checks for any unusual changes. Support blood flow through diet, exercise, and lifestyle. Stay proactive with regular doctor visits and screenings. Taking care of your penis isn't just about sex. It's about dignity, health, and confidence. The small steps you take each day can lead to major benefits, not just for your body, but for your quality of life. Thanks for watching. If you found this helpful, don't forget to like, share, or subscribe for more health content tailored for men over 50. Stay healthy, stay informed, and take charge of your wellness. Let's take a deeper look into each of these habits and explore some practical ways to build them into your everyday routine. When it comes to daily hygiene, one of the simplest upgrades you can make is to start your day with a shower and end it with a brief rinse at night, especially if you're prone to sweating or live in a humid climate. During the shower, focus on using lukewarm water rather than hot water, which can dry out sensitive skin. Instead of applying soap directly to your genitals, lather it in your hands first, or use a soft cloth to gently wash the area. Rinse thoroughly to avoid any soapy residue, which can cause itching or redness. As we age, the skin becomes thinner and more susceptible to tears or microabrasions, so even the way you dry off matters. Consider switching to a microfiber towel, or one made specifically for sensitive skin. If you're someone who has experienced recurring fungal infections or irritation, applying a light dusting of talc-free body powder or an antifungal powder after drying can help keep the area fresh. Moving on to underwear and comfort. This may sound like a small detail, but upgrading your underwear can have a surprising impact on your daily comfort and long-term health. Look for brands that advertise breathable, seamless designs with moisture-wicking fabric. Bamboo and modal blends are increasingly popular for their softness and airflow. Avoid synthetic materials that trap sweat and steer clear of tight waistbands that can restrict blood flow or cause chafing. If you exercise, garden, or spend extended time sitting, which many older men do, changing into fresh underwear or taking a quick rinse afterward can reduce the chance of rashes and bacterial buildup. It's also helpful to sleep without underwear or in loose-fitting boxers to give your skin time to breathe overnight. Monthly self-exams are quick, easy, and incredibly important. Do them after a warm shower when the scrotal skin is relaxed. Gently roll each testicle between your fingers and feel for lumps, hardness, or changes in size. Also check the shaft and head of the penis for any new marks, swelling, or lesions. If anything feels different, make a note of it and revisit it a few days later. If it's still there or has worsened, schedule an appointment. You don't need to become obsessive, but staying familiar with your own body helps you detect changes early. Many conditions, from testicular cancer to Peyronie's disease, a curvature caused by scar tissue, are far more treatable when caught early. Let's talk more about blood flow and lifestyle, a topic that connects your sexual health with your overall cardiovascular wellness. The penis depends on strong, healthy blood vessels. When circulation declines, erections weaken. Think of your penis as a barometer for your heart health. Adding more leafy greens, berries, whole grains, and healthy fats like olive oil or avocados can increase nitric oxide in the blood, which improves blood vessel dilation and supports stronger erections. Limit processed meats, fried foods, and excessive sugar. Moderate caffeine, on the other hand, has been linked to better erectile function. Exercise doesn't have to mean joining a gym. Brisk walking, yoga, tai chi, or even yard work can help. If you're sitting for long periods, take breaks every 30 to 45 minutes to stand, stretch, or walk around. This is particularly important for men dealing with mild pelvic congestion or discomfort from a sedentary lifestyle. If you smoke, quitting is one of the best decisions you can make for your sexual and overall health. Smoking damages blood vessels, decreases oxygen delivery to tissues, and can contribute to erectile dysfunction. It's never too late to quit, and even men in their 60s and 70s report improved sexual function after giving it up. Chronic stress, often overlooked, plays a major role in testosterone suppression and reduced libido. Make time for relaxation. Whether that means meditation, reading, gardening, or regular social interaction, managing stress supports hormonal balance and helps maintain interest in intimacy and connection. Now let's go deeper into medical screenings and professional support. After age 50, regular checkups should include a digital rectal exam and PSA blood test to assess prostate health. While the PSA test has limitations, it can help monitor for abnormalities when used alongside clinical exams. If you notice symptoms like dribbling after urination, difficulty starting the stream, or getting up multiple times a night to pee, don't dismiss them as just aging. These could be signs of BPH, which affects about half of men over 50. Treatment options range from medications and lifestyle adjustments to minimally invasive procedures. In terms of sexual health, many men are hesitant to talk about erectile dysfunction or reduced libido, but these issues are extremely common and treatable. Don't let embarrassment delay care. There are now options ranging from oral medications and testosterone therapy to low-intensity shockwave treatments and counseling. Your urologist can guide you through what's appropriate for your body, medical history, and goals. And finally, don't forget mental health. Depression, anxiety, and isolation can all negatively affect sexual desire and physical function. Stay connected with your partner, your friends, your hobbies, and your community. These connections help sustain your emotional resilience and promote a fuller, healthier life. Let's summarize one more time, but this time with some action steps you can start today. Start and end your day with a quick rinse or wash. Warm water, gentle soap, soft towel. Upgrade your underwear drawer. Aim for cotton or bamboo, and consider going commando at night. Set a reminder on your phone once a month to check yourself. It takes 2 minutes. Move daily. Even light activity improves blood flow. Cut back on sugar and processed foods. Make an appointment with your doctor if you haven't been seen in over a year, even if you feel fine. Taking care of your penis in your 50s and beyond is not just about preserving function. It's about honoring your body, staying alert to signs of change, and embracing a lifestyle that supports energy, vitality, and confidence. Your health doesn't stop mattering after 50. In fact, it matters more than ever. Thank you for being here and taking the time to invest in your well-being. Make sure to stay tuned for more health-focused content designed specifically for men in midlife and beyond.